Hey everyone, so today I'm back with another mock USMLE question. This is going to be question number 22. So the question is, you have a 65-year-old male, past medical history of high blood pressure and hyperlipidemia, who comes to the clinic with complaints of erectile dysfunction. Patient reports increasing difficulty in maintaining an erection satisfactory for sexual intercourse, leading to increasing embarrassment. Patient denies any stress or anxiety and denies presence of any constitutional symptoms like fevers, chills, weight loss. Medications include lisinopril and atorvastatin. Temperature is 36.2, blood pressure is 133/94, and pulse is 84 beats a minute. Physical examination shows a morbidly obese male, with the physical examination being otherwise unremarkable. BMP and CBC are within normal limits. What is the most appropriate next step in management? The options are start PDE5 inhibitors, order penile Doppler ultrasound, recommend weight loss and dietary modifications, or prescribe intracavernosal injection therapy. If you need more time, go ahead and pause the question here. The correct answer is recommend weight loss and dietary modifications, option C. So the reason this is the correct answer is, what you have to remember for this question is, when you have a patient with erectile dysfunction, the first step in management, a lot of people think incorrectly that it's medication. You start with PD5 inhibitors like Cialis. But in fact, the correct answer when you have a patient with erectile dysfunction is first you want to manage it conservatively with weight loss and dietary modifications. For a lot of patients, that can lead to improvement in symptoms. Now, if those dietary modifications and conservative management is ineffective, after that, the next step is prescribed medications. So that's why the correct answer isn't A, but the correct answer is for C, weight loss and dietary modifications. The other thing I also want to briefly mention is whenever you have a patient with erectile dysfunction, it's also important to assess for whether the patient has any reversible causes for it. So the two reversible causes that I see tested very frequently are stress and medication. Stress, when patients are stressed out, have a stressful job, often in that situation, patients can have erectile dysfunction. And in this question, I did tell you that patient denies any stress and anxiety. So it's very important to ask for or assess in a patient with erectile dysfunction. The second reversible cause of erectile dysfunction that's very commonly tested is medications. So for instance, someone taking SSRIs can often have erectile dysfunction. In this case, our patient doesn't take any medications that are associated with erectile dysfunction. So once you rule out any of the frequently common reversible causes, once again, the management and treatment will be first weight loss and dietary modification, and then if that's ineffective, prescribe medications. So that's going to be it for today. If anyone has any questions, feel free to put a comment down below.